A pedicled tram flap involves transplanting the lower abdominal skin and fat, the skin and fat that you pinch below your belly button. We transfer that up to the chest to reconstruct a breast. That is the purpose of a pedicled tram flap. The skin and the fat of the lower abdomen that's transferred is kept alive by leaving it attached to the rectus abdominis muscle. So the entire muscle is cut on one side, and the upper part of that muscle, the superior side of that muscle, is left in continuity to maintain blood flow to the skin and the fat of the lower abdomen that are tunneled up to the chest to reconstruct a breast. So this is a great option if you need to reconstruct one breast with abdominal skin and fat. I do not like this option to reconstruct both breasts because it is it's a big hit and it's very morbid to the abdominal wall to sacrifice both rectus abdominis muscles to reconstruct both breasts. So a pedicled tram flap, in my opinion, is a good option to reconstruct one breast with lower abdominal skin and fat. If you need both breasts reconstructed with abdominal skin and fat, then I would recommend the DIEP flap operation. This involves microsurgery and involves transplanting the abdominal skin and fat to the chest. But the beauty of the DIEP flap is that it does not sacrifice the entire rectus abdominis muscle. I mean, ideally it sacrifices no rectus abdominis muscles, even though the rectus abdominis muscles are incised to get the blood vessels out. It is much less morbid to the abdominal wall compared to a pedicled tram flap. Now, again, if you're having both breasts reconstructed to preserve your abdominal wall, you need bilateral DIEP flaps performed. If you're only having one breast reconstructed, a pedicled tram flap is a reasonable solution and technique to reconstruct one breast using lower abdominal skin and fat. The final scar and incision is the same as a DIEP flap. It is a lower horizontal scar or incision across the lower abdomen. I do need to place mesh in every patient I perform a pedicled tram flap on in order to restore the integrity of the abdominal wall and reduce the risk for hernias and bulges. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.